I hope you are all in good shape and good health, and I hope we can make this presentation a small success. And for surely, I hope the connection holds. We'll see what the cable from the continent Europe to the continent Africa is doing and how we keep holding on. The subject we are talking about and it's given to me is assuring optimal health in broilers. But first, I would like to introduce myself to you. My name is Derkx, veterinarian, married, 3 children. I take care of the veterinary service of EMEA. I take care of contacts, government exports, pure line, GPS, hatcheries. That is what we are doing at this moment. So if you have any questions, just pop them up and I will answer them at the end. Yeah. From your side, several questions were coming up from your side, which you see here. You wanted me to talk about leg problems in broilers, 100% covering when you talk about vaccinations, especially when using injectable vaccines, and the importance of hatchery hygiene management. This subject is something where Mark will talk about. The other object you would like to talk about is drinker line hygiene. This is already stressed by Brandon, and I will jump up a little bit on water. So combining all these things, your questions and the optimal health brings me to optimal health. What is that? Well, maybe one of you knows, but I do not know exactly. So what we do is what we see as optimal welfare for birds. Then you come up with those 5 issues, and we call that the 5 freedoms of animals. So we talk about good water, good feed, and Edward will talk about the feed, I think on Friday. Expressing natural behavior, that is an important one. No overstress for the birds, no discomfort for the birds, and freedom of pain, injuries, and diseases. You have to realize that it is very difficult for birds to express natural behavior as we keep them now in high density housing. But still we can do some things there to improve that. Water. When we talk about water, now you see this picture here, and we look at water quality, you have to follow the red pointer here a little bit. These are the values we add to that. So a level considered average, a level considered maximum, and then you have here the last one, which is the range in literature. Now you can, when you talk about water, you can divide that into 2 major groups. So let's call it the bacterial component and the chemical component. These are the 2 things we find. The bacterial component, we are quite confident and we can do something on that level by using water disinfection, which is a good tool by itself, provided you keep some rules in account. The chemical component is a bit more complicated. When you talk about total dissolved, you talk about hardness of water, you talk in your area about iron, lead, magnesium, nitrate, sulfate, zinc, sodium. And I remember one case in Africa where we had a huge issue with a client from COP Africa who had an enormous bromide risk in the water, and the birds were simply dying due to liver ruptures. So water is absolutely something to keep in mind here. One of the major issues is when you look at the maximum accepted level, that is that in some areas we find sub-maximum levels. So let's say you find a chloride of 200, but next to that, we find a nitrate of, let's say, 20, and a sulfate also of 200. And then is where the science goes wrong. Then we don't know what the interaction between those metals is on the bird. That is a a weak point in our understanding of this one. And you can see that popping up. If you have issues with your borders on kidneys around 14 days of age, so let's say between 7 and 14 days, where the water intake compared to the body weight is maximum, there you will find your major issues. When your growth is delayed there, then you have to keep those interactions of acceptable levels in mind. For keeping, there are several ways where you can reduce levels like calcium, chloride, copper. The most used is reverse osmosis, which is something which is easily implemented. It's quite expensive, which is easily implemented when you live on a coastal site because you have wastewater from reverse osmosis, and which you can get rid of in the sea. But on land, it is a factor which we have to consider, that you have at least 10% wastewater with reverse osmosis, and you have to dump that somewhere. And if you dump it on the land, then you destroy that land also. So that is a consideration in that technique on land, which is limiting. Water disinfection is something we can do. It depends on the water pH. So the pH stands for power of hydrogen. And if your pH is below 7, then chlorination is a good tool, because then your H atoms are quite high and they will chase away the potassium, and you will keep hypochlorous over, and that will be very effective. When we have a high pH, the amount of H atoms in the water are limited, and then it doesn't work that good anymore. Then it stays in potassium chloride, as mentioned here. Above 7, the pH, we use peroxide or chlorine dioxide as an active ingredient, which is working. So chlorine dioxide is actually the only one which is recommended to use above 7. Peroxide is easily applicable. So this is what we do. We reduce the amount of bacterial and contamination in your drinking water, and with that give the birds a better start. When you talk about natural behavior, birds must be able to walk freely, so we don't want to see any lameness. Lameness we can define into 2 groups: infectious versus non-infectious. And the ratio we normally see in lameness birds is 50-50. If this is different, if you see, for example, 70-30 infectious versus non-infectious, then there's something specific wrong. Talking about lameness, continuing on this one. So this is the skeleton. One thing you have to know, and the point is going here. So on this point, this is what we call the thoracalis 6. That is where the movement of the spine is possible in the chicken. So this part is fixed, and this part is fixed. The movement takes place where the pointer is, and that is also where you find your kinky backs. We'll come back to that. Infectious, femoral head necrosis, that's an osteomyelitis, synovitis, and spinal osteomyelitis. This is your kinky back. Viral, we see Rio, and on broiler level seldom, but possible Marek. When you talk about the non-infectious issues, we talk about genetics. Say, splay legs you don't find easily in layers. We talk about metabolic issues, with the rotation of the femur, a rotation of the tibia, a spondylolisthesis, that's a difficult word. So this is a not straight vertebral column. This is something we don't see that much in borders. Sometimes you see this in males and breeders. Tibial dyschondroplasia, that is a typical issue we find in broilers, and the calcium phosphor vitamin D imbalances, rickets, that is what we find in broilers. So part of this metabolic issues is also feed related. Display legs. This is something which you see from time to time, and it's always when we see this a lot, we go to the hatchery and try to fix the hatchery problem there. What we see as causes are hatching temperature in the last part of setting, so fluctuations in the temperature when especially too hot. The second thing we see is belts in the hatchery, so they are too slippery, and when these legs are split out, for example, when you see in the middle chick here, when these legs are split out, that muscle is stretched. It is called the musculus adductor, which is the inside of your thigh, the chicken thigh, and he doesn't get the leg under the chicken anymore. So this is what happens with slippery bells and also slippery paper in the brooding period. Now this is just a picture just how to show you that you can correct it. And maybe some of you have been working in pigs, and this is what we used to do in pigs and also in sheep. We use this kind of techniques practically to correct splayed legs. Prevention is mentioned, the incubator, slippery bells, and smooth chicken paper. The osteomyelitis. So this is an infection of the bone marrow we find on two spots. As mentioned on the T6, the thoracalis 6, you know, the skinky back, and in the hip, where you recognize that femoral head necrosis. The bacteria we find there mostly is a staphylococcus, and from time to time an E. coli, that is for here the femoral head necrosis. And here in the T6, it is mainly a bacteria called Enterococcus cecorum. And this bacteria here, this Enterococcus cecorum, this brings me back to the story of Brandon, because one of the issues where that bacteria enters the body is through the intestinal tract in the brooding period. You clearly can relate this disease, this kinky back, to gut leakage in the first week of life. This is quite well known and quite good investigated. We see flocks having this issue here, even with 10% of the birds. So that is a lot, and these birds are lost. So the osteomyelitis, you see here, there's a necrosis in the bone marrow popping up here to say this growth area is looking quite good. Here we have to be careful because this is a loose femur cap. Going back to the previous slide, then this part breaks from the bone itself, but this is most of the time due to us, the way of opening and doing the postmortems. I understand we can have a postmortem session later on, and maybe we can show you some pictures from that later. Here, this is an infarction, what you call, where the blood vessels close down and there's simply no blood supply to the bone marrow. Femoral head necrosis. This picture here with the yellow arrow is probably the best where you see the femoral head necrosis popping up. Here it is a bit less. What do you see? And this typical thing, you see lame birds, of course, you see wing walking, you see a trembling gait, post-mortem, do a bacterial culture and the sensitivity test. I must say here, I must add to this one that actual treatment of an infected flock, of an infected bird is not very effective. So therapy is not easy. It's not easy for this. That bacteria is so hidden that simply the antibiotics do not get on the right spot. Most found are Staphylococcus and E. coli bacteria. Spinal osteomyelitis. Here you have on that thoracalis 6, which I showed you in that picture, you have an abscess pushing up, and that abscess is pushing it towards the spine. The next picture shows it a bit better. Here, this is a push-up onto the bone marrow. And this process, on broilers, it is almost always bacterial. As I mentioned, the Enterococcus cecorum gut leakage. On the sterile also happens, but we see that in breeders, where due to treatment or dumping, letting the birds fall from big height, you get a nick here, and then these birds, they get typical lameness. What you see on the birds, very typical, they sit on the cloaca. So they don't sit on the belly, but they sit on the cloaca. They have the legs stretched to the front. And when they walk backwards. There's some blockage here of control nerves, how to walk. And then the autonomous, there is an autonomous process, autonomous process in the spine where the bird starts walking, but he simply walks back. Here again, another one. This is a very nice one. Synovitis, so the classic synovitis as a primary cause, we don't see that much. We see synovitis, yes, we do, but not that much as a primary cause. The bird, for example, has TD or female head necrosis, he sits more, he gets what we call the perisynovitis, and then the infection comes also into the joint. One of the diseases where you have true synovitis is Mycoplasma synoviae. That is something we can find from time to time. And you must realize for Mycoplasma synoviae, you have strains typical giving lameness, and you have strains giving other diseases like damaging the ovary and the ovary duct. So keep in mind, synovitis is most of the time secondary to another kind of issue. This is in Angola, we sometimes find these hawks. Same story. The rickets, it's not often that we see them but it happens. And for example, people know quite well how to handle calcium, phosphor, things like that, and how much it should be, but it happens from time to time when disasters happen. For example, taking Lebanon, where they had a big explosion, there the harbor is bombed, and people will have problems getting the right feed ingredients. Getting the right feed ingredients into the bird, but not that much anymore. Now you see here a differentiation which makes it easier. So here you have the osteomyelitis. You have the growth area is quite normal. Here you have the rickets. And this is something typically you have to keep in mind. You see the lining, the vertical lining is quite typical in this case. And this is something often we see with phosphor. Yeah? This is a normal growth pattern and a normal bone marrow. TD, tibial dyschondroplasia. In essence, the tibial dyschondroplasia is the possibility of certain cells, and these are the chondroclasts. So chondro stands for bone cartilage, and clast is a breakdown. So these are cells who break down the cartilage. They are blocked. They cannot do their function properly anymore. You see here what we call the grade 1, grade 2, and the grade 3. We see it from time to time, and it is absolutely something which is feed mill related. So here, later on, Edward can give you some good ideas on that. The rotibia, rotation of the tibia on the distal part, this is something what we see regularly from time to time. Here, this is a normal picture. So when you take your foot and turn it outside, yeah, that is what is happening here. So your knee is normal and your foot is standing outside. That is the picture we see here. Here again, here you have a normal picture, and this is a twisted one, and this is how it looks in reality. The reason why for this rotation is not fully understood, but we cannot find anything infectious or bacteria, viruses related to this. And we think it has to do with, again, the cartilage development in the first days of life, even possibly in the egg. Here, this is a picture, you know, it's a slip tendon. You have slip tendons, pierosis. Originally, then you have to look again into your feet and you have to look into your manganese issues. There is something involved in that for a true slip tendon. What we see here is an MRI scan of the left leg, frontal view. So you put your left hand on your left knee. It's a good exercise now to stand up for a second. Left hand on your left knee, and you look downwards and you look to your leg, and this is what you see on that chicken. Yeah? You see the small toe bending backwards on both sides, but the typical thing is that here we have a curving of the tibia and mainly seen of the fibula. And the fibula is, I think you call that the needle bone with a sharp point, which is sometimes used to, for teeth. Yeah. This is the difference what you see in the tibia rotation. What can you, as a broiler farmer, do to avoid lameness? For the broiler farm, proper house clean out, proper brooding. A very critical one is dry litter. That is one of the very critical points in this process. If you see any metabolic lameness issues, a vitamin suppletion is the first thing you do. And then you do not talk directly about water-soluble vitamins, but we talk about vitamin D and possibly check calcium phosphorus. If you see wet droppings, look for the cause and treatment. Very often we see that wet droppings go together with the bacterial infection inside the intestinal wall or in the intestinal wall, and birds are treated with an antibiotic. You have to know your cocci status. If you have coccidiosis, the rest of the diseases is coming by itself. And you must have a good dark out program. I just give one here. This is not directly my field, but this is what is most used in the field. So you talk about 16 hours light, 4 hours dark, 2 hours light, 2 hours dark, make the program. But be sure that between the first dark out and the second dark out program, there is enough space for the bird to eat and drink. Freedom of diseases, coming back to the beginning. Biosecurity. And then we talk about a vaccination program, which is the last subject I was going to do. The vaccination program. This was one of your questions. But your veterinarians, I saw at least one veterinarian in the audience, Susan's is with us. Your veterinarian team has made a vaccination program. How do you know it has been run properly? Well, there are some tools. A dye. Use a dye, a color, when you spray at hatch. And here you see a red dye, reddish dye, but the darker the dye, the better the bird takes it. So we don't have black dyes available. I didn't see them yet, but we green, purple, that kind of dyes are best. So the contrast for the bird is much clearer and you pick up the droplets. This is an automatic machine which can produce thousands of birds. I don't know if you have them somewhere in. Injection. Here again, use a dye. What you see here, this machine is injecting the bird, but also doing a debeaking issue. They are injected in the neck, and we use a dye for that. And you can see the dye easily popping up. It should be there, that color. Water vaccination, same story, use a dye. The scores for using these products, the hatchery, which we accept as good, the injections, 98%. I can tell you, this is not easy to achieve. The spray hatchery, 90%, and the water in the farm, 95% score. 95% of the birds should have some marking, some coloring. Tools to check your vaccination program, serology. For the IBV, we have a very nice tool. If you vaccinate the bird for IBV or any other corona-related virus, by the way, for you, infectious bronchitis is a coronavirus belonging to the family of COVID, SARS. Unfortunately, it doesn't protect against COVID, SARS for humans, so don't vaccinate yourself with IBV, it will not work. The first 14 days after IBV vaccination, the bird builds up a certain antibody, and we call that IgM antibodies. They are the first produced. Within 14 days after vaccination, the score should be 80% positive. And we have a simple ELISA for that, which we use to check if the vaccination is done properly. So you take blood 14 days after vaccination, you see 80% positive, you are happy. If not, go back to the application. Unfortunately, we do not have this tool for Newcastle, IBD, avian influenza. Here we have to do with serology end of life. Second, the borders by PCR. This is not very common, but it can be done, and then it should be done something like 5 days after vaccination. Here we can use the palate cleft, spleen, the cloaca, the bursa, and we have no idea about the percentage. In theory, it should be every bird which has taken the vaccine, which has reproduced the vaccine, is positive, but real percentages are at this moment not yet known. Now, the message I have to you is be sure of a good water quality and preferably disinfect water. Keep controlling droppings and litter. There's where you can have a good profit. And check applied vaccinations. Okay, thank you for your time. Let's see if we have any questions.
Thank you, Dr. Derkx.
Yes.
Presentation. And the gremlins disappeared.
Yes.
Then I think we can give opportunity. Does anyone want to come online and come and join us and ask a question? I see there's 1 or 2 questions in the chat function. Anyone want to come online and ask a question to Dr. Derkx?
Theo, I have a question here coming from EV Missile.
Okay.
With female head necrosis, what is the prevalence that you have a secondary cholesepticemia, if any? The chance is very low. The chance is very, very low that that happens. It can happen, but most of the time not. So if we do postmortem surveys, we almost never find the relation cholesepticemia or polycirrhosis and female head necrosis. On all the birds we open, and we do thousands of those. The second question we have here, birds with swollen hearts at 7 will the first port of investigation to rule out MS? No. The first thing I would, at 7 days, that would be very early to see at that moment MS. The first point you will find that truly is around 2 to 3 weeks of age. So the minimum age is at least 14 days. There is a simple, there's a simple trick for that. I have to stop sharing for a second for that so that you can see me. If you open the joint and you put your finger in the joint and you pull up, you see the synovia sticking to your finger. That is correct. If you have an MS infection, you will see that that synovia is not sticky anymore, but very watery. So this is something which can easily be checked. So MS, no, I would say 14 days or 3 weeks at the minimum. Can rickets be diagnosed in birds below 7 days of age? In theory, it can. Yes, it can. Yeah. I don't see any further questions at this moment, Teal.
Yeah, I can't pick up if Kathy or Taryn pick up more questions, but I can't see either. So thank you very much, Dr. Andre, Dr. Derkx. And yeah, thanks for the informative information. I think then we can have a short break. Let's be back at say 25 past, and then we can continue again. Then we'll move into the broiler case studies. Yeah, so thank you very much for the presentation again, Dr. Derkx.
Thank you.